Hi, Dr. Lim. It's so lovely to have you join us at the 100th conference.
Good morning. Nice to see you.
Am I catching you at an okay time?
Yeah, I totally have time for you.
Yay, lovely. So what do you think of the conference so far?
Oh, the conference is so great. It's so great to be in Halifax. I love eating all the food and seeing all my friends, and I'm learning lots too.
How does ongoing education, like conferences and say peer collaboration, help you stay current in your field?
One of the things I really love about this conference is going and really challenging my thought process and what's new in the field. So thinking, why am I doing certain things? Like, what are other people doing? And what am I going to bring back to my practice and change? So it always allows me to stay curious and just always be at the top of my game.
Is there anything on the program that you're particularly excited about as a Mohs surgeon?
Oh, there's so much, but I am most excited for the talks on artificial intelligence. This is coming at a super rapid pace, and I really want to continue to integrate it into my practice. I already have learned of a few new apps that I'm going to integrate that will really just help with efficiency and ultimately just benefit everyone.
For those who may not be familiar, can you briefly explain what a Mohs surgeon actually is?
Good question. So a Mohs surgeon is a dermatologist, and what we do is we perform surgery for mostly basal cell and squamous cell carcinoma in cosmetically sensitive areas. So that's areas like the hands, neck, the head, neck, hands, feet, genitals, where you don't want to take off more tissue than you need to because it's expensive real estate. So this way we numb it, we do it all under local anesthetic, it's super safe, and we're able to achieve super high cure rates because we're only taking what we need, and we're also assessing 100% of the margin to make sure that everything's removed. And then the fun part is getting to do the reconstruction afterwards.
What drew you personally to specialize in Mohs surgery?
It's hard. I love all aspects of dermatology, but I think early on I knew I loved skin cancer. I had never really envisioned myself as being someone super surgical, although I did like procedures, but I worked with an incredible Mohs surgeon, Dr. Jillian McDonald, who I still get to work alongside as my colleague, and it was so inspiring. I feel like my patients come in, they have a problem, and I'm able to fix it or cure it that day. And I know that I'm giving them the Mohs technique, which really is the best treatment option.
What skills or qualities do you think are essential to succeed in Mohs surgery?
Oh, there's so many different aspects of Mohs surgery. I think that you need to have a lot of patience and attention to detail. A lot of what we're doing, we're dealing with fractions of millimeters and microns, and being able to be precise and have the patience to do that is really important in this very specialized surgical technique.
How long did it take you to complete your Mohs training after medical school and dermatology residency?
Mohs surgery is a one-year fellowship. There are a few programs in Canada which are awesome, and I trained in San Francisco at UCSF.
Can you walk us through a typical day in your practice?
A typical day, well, it's always different because you never know what's going to walk in the door. Might be a small primary basal cell on the nose or on the cheek, or a multiply recurrent skin cancer on the nose. I think you just have to expect the unexpected and just roll with it. I typically, arrive and we start around 7:30 or 8, and then the first part of the day is really the tumor clearance, where we remove all the skin cancers, analyze in the lab, and then I look at it under the microscope. And then the second part of the day is doing the reconstructive surgery for the patient.
Do you practice in any other areas of dermatology outside of Mohs surgery?
Yeah, so Mohs is my specialty, but I love all aspects of procedural dermatology and skin cancer. So I also work at the Ottawa Regional Skin Cancer, and I care for patients with high-risk skin cancers, especially transplant patients. That way I can screen them and then also take them through the surgery and follow them. So I have this really nice longitudinal care with them. And I also perform cosmetic procedures like lasers and injectables.
I am curious, how long does a surgery often take?
Like I said, surgery can be super unpredictable. Some people are in and out in just a few hours, but it's not that infrequent that someone is there from breakfast all the way until supper time. It really depends on the complexity of the tumor and the patient that I'm treating.
Most surgery is often used for skin cancers in high visibility areas, like you said. How do you approach balancing medical success with cosmetic outcomes?
This is a super important question because although patients come in for a cancer surgery, it's their face and they're always, really worried and anxious, like, what am I gonna look like after? And there's a lot of bruising and swelling. So I always remind them, goal number one is I'm trying to cure your cancer. We wanna get rid of this so it doesn't come back. But the goal number two, which is equally important to me, is making sure that they have a really nice aesthetic result. This just involves a lot of patient counseling, managing expectations, but most people do extremely well and they're really satisfied at the end.
How do lasers or injectables enhance patient outcomes in combination with surgery?
Well, as a surgeon, I'm really good at making scars, but I'm equally passionate about treating them. So not only surgical scars, but traumatic scars, acne scars. And so I have at my fingertip and access like a variety of vascular lasers, fractional ablative and non-ablative lasers. And I'll use this just to complement the process so that patients can ultimately get a result where they feel they're most confident.
How does working closely with other specialists help you to do better at your job?
Oh, it's so key to have a good working group with your medical, surgical, and radiation oncologists. There's no one treatment that fits all, so we collaborate on the regular just so that patients can have the correct follow-up, the correct treatment that they need.
Do you work closely with other medical specialists like plastic surgeons or oncologists in complex cases?
Yes, routinely I have plastic surgery help me with complex reconstructions. Some patients require adjuvant radiation, and so being in this tertiary care center, I have access to all of those specialists to help me and the patient.
What do you find the most challenging about your job?
My job is really unpredictable, like I said, every day, but I have to say it's challenging to manage, to work and do your best in a healthcare system that's really strained for resources. So right now our wait time is really long and we're working on that, but there's just so much skin cancer. So I want to be able to offer the best for my patients, and we do with Mohs surgery, but it can be a little frustrating when you just need more resources to help more people.
What's the most rewarding thing about your job?
Oh, I love my job. I'm really fortunate, but I have to say it's definitely my patients. They're so thankful at the end of the day, and to be able to have that relationship, really, it's really valuable.
What's one thing they definitely didn't teach you in med school that you had to learn with personal experience?
I think they tried to teach this in med school, but not every patient, it's not a computer algorithm. That's why AI is not going to take over my job. Everyone is super unique. When you think about the reconstruction, not everyone's nose is the same. The sebaceous quality is different, the texture, the sun damage, thickness. And it's the same, although I love doing surgery, sometimes it's not the right option for the patient. So really taking that into account and making sure that you can make that decision together is something that I've learned just out in practice and in residency.
What advice would you give to dermatology residents considering a subspecialty in Mohs surgery?
Well, I would say I strongly recommend it. I love my job. If you are considering going into Mohs surgery, make sure you really focus on the basics. So you need to be a really good medical dermatologist. You need to feel strong in diagnosing skin cancer. And if you really work hard at solidifying those foundations, you'll just do incredible when you go on to fellowship training.
How has Mohs surgery evolved? And what role has it played in shaping modern dermatology?
Well, Mohs surgery has changed a lot. So initially, when it was developed in 1930s by Frederick Mohs, they were using zinc chloride paste to fix tissue. It was painful for patients, and it wasn't something that was done in one day. It was done over a few days. But the technique was really revolutionized in the 1970s at UCSF, where I trained. So they developed the fresh frozen method, and this made Mohs surgery much more accessible, faster to do, and a more comfortable procedure to patients. So that's really changed the Mohs technique.
Looking towards the future, are there any advances or emerging technologies in skin cancer treatment or reconstruction that you're particularly excited about?
Although I'm a surgeon and I love cutting things out, I am excited for topical hedgehog inhibitors and to see what role this will play in treating basal cell carcinoma. as well as the trials that look really promising using intralesional cemiplimab for cutaneous squamous cell carcinoma. I think this will be a nice adjunct in combination with surgery.
Now I have to go in just 1 second, but I have to ask, is performing surgery anything like what it looks like on TV?
Sometimes I feel like it when there's blood oozing everywhere and you're asking for more gauze. So probably for me, yes. But fortunately, dermatologic surgery is really safe for patients. It's all done under local anesthetic, so it's probably not as dramatic as it seems.
Speaking of TV, if you could star on one medical TV show, what would it be?
Okay, I recently binge watched The Pit, and this show made me seriously consider going back to residency to be an emergency room doctor because I loved the adrenaline and the rush of it all, but then I came to my senses and realized I'm already in the best specialty.
When you're performing surgery, do you wear scrubs, a lab coat? What's that like?
When I perform surgery, I wear scrubs and a scrub hat, super comfy shoes, and I always have my loupes with me and my dermatoscope.
Okay, I have one final question. If you could change one public perception about dermatology, what would it be?
I think that the general public often sees dermatologists as pimple poppers or just estheticians, but I wish that they knew that we are medical doctors who went to school for a long time and manage really complex skin cancers and inflammatory dermatoses. And particularly with Mohs surgery, dermatologists are dermatologic surgeons and we are experts in cutaneous reconstruction. So I think as long as we continue to promote our specialty over the next few years, we will really improve our perception of the general public.
And that's a wrap. I better let you get back to the conference. Thanks, Dr. Lim.
Thank you so much.